Hello, everyone. Welcome. We have an amazing guest today, and her name is Kelli. She is just this beautiful, gorgeous lady, not only beautiful on the outside, but also beautiful on the inside. And she's coming here today we're talking about body image. And I describe her as wherever she goes, she brings this light with her. And I wanted to share a little bit of her with everyone. So, hi, Kelli. Welcome.
Hey, Kelly. Welcome to our podcast. We're so excited to have you. And maybe if we just started with share a little bit about your diagnosis, and then we'll get into body image and how you've managed keeping a sense of yourself after having a double mastectomy. So, like, how recent were you diagnosed with your with breast cancer?
Yeah, absolutely. And it's actually very new, I think, compared to a lot of ladies out there and gentlemen. I went for my routine mammogram in February of this year, February 2022. I've always had dense breasts. So I've always, been very faithful in my mammograms. Of course, with the pandemic and such, I got a little bit off track, as did many, I'm sure. But went back at it in February, and then in March got the diagnosis of breast cancer on the right. God, I think God put me in the right place at the right time. Born and raised in Ohio, but have been living in Texas for about 30 years actually. And had just recently really been drawn to move home. And so I don't think it is just coincidence that I landed back in Ohio and to have this diagnosis, to be supported by family, and then also just to be blessed with Dr. Halaharvi, who my family knew, some of my sisters who are also physicians, and they're like, oh, you're in the right place. We know where we're going to take you. So then diagnosis in March, and in May, went in for the surgery, chose to have the double mastectomy, with the guidance of Dr. Harvey and what was best going to be best for, based on my results so far, and actually had a Goldilocks mastectomy, which was really exciting. And Dr. Harvey, I'm sure you'll probably want to speak a little bit to what that
Yeah,
is.
is performed for those women who are either not candidates for a reconstructive type of reconstruction after mastectomy. So what we do is at the time of the surgery, we remove the breast tissue and we just use the skin, that your own skin, because you have a lot of skin. So we just fold that into making like a little bit of a breast mound. And so when you wake up, you're not completely flat chested. You have a little bit of a breast mound. And if you ever want to get reconstruction, then the plastic surgeons can use that skin to perform reconstruction. And so for you, in your case, that's what you wanted to undergo, is the Goldilocks mastectomy. Again, this does not have any placement of any foreign material in your body, like a tissue expander or an implant. So there's risk of infection is much lower.
And so you have the envelope still to the breast,
Yes,
and then
yes.
you're putting the skin in the breast.
In
Is
the
that
area where the breast tissue used to be.
okay?
So I describe breast to be like a pillow in a pillowcase. So when we do a mastectomy, we're removing the pillow. You still have the pillowcase. In some women who have large breasts like yourself, the pillowcase is very long. So you use the bottom portion of the pillowcase to fold it, and you take the top portion to cover it over it. And so
Wow.
then it creates a little bit of a breast mound. So at any point, did you feel sadness in losing your breasts?
I did. And I think because I was thinking about just trying to stay positive and everything. And I don't want to be one of those people that's like toxically positive, right? I
Yeah.
went through
Yeah.
all of the depression and the sadness and the scared and the mourning and all of that. But I just tried not to stay in that place for too long because I've always been a very large breasted woman. When I went into surgery, I was 44 triple D. And I felt like that was part of my identity. I thought that's Kelli, that's me, right?
Yeah.
Being a larger woman, that helped balance out my weight. So I still looked curvaceous. And I thought, oh my goodness, what's going to happen? I'm not going to be me. At first I was like, no, 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 we can't take them. We have to take as little as possible. I went through the whole gamut of emotions and thoughts and choices. But very quickly, I feel and definitely with your help and education of everything, that it was going to be the right thing to have the double mastectomy. And if I could share a story really quickly, I think the thing that really was a big eye opener to me, and I will tear up when I say this, I'm sorry, but when I called to give my son the news of what was happening, and I was crying, and the whole gamut, we were going through all the emotions, and This kid, 23, smart as a whip and very firm in his faith, said, "Mom, it's just flesh.
Mm.
It's not your soul and it's not your heart. It's just flesh. And in the flesh is sinful." And a light bulb went off. And I just thought, you know what? He's right. Losing my breast changes absolutely nothing about the true essence and core of who I am. It is just my silhouette, what size shirt I'm going to get to wear. Yeah. And so it just really, the kid is smart. He was right. It's just flesh. It can happen to anybody at any time to lose something, right? But it's not you. Like,
I do want to say for the listeners, whenever a woman decides to undergo a double mastectomy or removing both breasts, it really doesn't have any survival benefit, meaning it doesn't increase your survival, but it does, help you with symmetry purposes. And one of the other benefits is you don't have to get a mammogram ever in the future. So that's another benefit for you. It does have risks and complications of infection, bleeding, so on and so forth. So we tell people it's a shared decision making. It's not something that
mhm.
it's between the patient and the physician. And so no one should ever force you to have a double mastectomy, but it's usually a shared decision making between the patients and the physician. So, and that's an important point to say, because it's your body. Again, it's your body. It doesn't define who you are. And just before the show, I was telling Monica, 75% of the women struggle with body image issues. And I have a patient, my youngest is 19, my oldest is 96. And I have seen women of all ages who struggle with body image issues. And I think a lot of that comes with how we grew up in America. When you watch TV or commercials, there's all these women with sexualized breasts, and they are not real women. They are not, they are, have all these filters and makeup and the touch-ups, and it's not real people living real lives. It's just something that advertising does to you. And so we sort of develop our identity watching that growing up. But breasts really don't define who you are. What gets defined who you are is really sits on the inside. Said it, your son said it very beautifully.
Mhm.
So
Yeah, he did. And it was, I'm not going to say it wasn't scary the first time that I decided to kind of go out in public, like really out in public, not just, to the doctor's visits and such, but to go out like for dinner or something. And it was a little scary because I thought, oh, people are going to stare at me. It's going to be noticeable that I have this, odd shape. Don't have the
yeah.
breast to kind of balance out my curves anymore. And I got out in public, and guess what? Nothing happened. I was
You know,
like, this is so cool. Nobody's looking at me.
a little story of myself, like I had breast surgery, I had tissue expanders, I had a double mastectomy as well, tissue expanders, had infection. I talk about this very frequently because nothing is without complications. So I had to have the tissue expanders taken out, and I had like nothing, flat chest. So I wore prosthesis for a year before I then decided to go back and get reconstruction. And honestly, I thought the same thing. People are going to look at your chest. No one really cares. People are really looking at themselves or thinking about that. They really don't care about you as much as we think that they do. So that's a
Exactly.
really great point, and the world goes on.
Yeah, absolutely.
I think I look at breasts more now. Not survivors, but like I have boob envy sometimes, and I see like
Yeah,
Oh,
I
yeah.
think that's real too. And learning how to manage that, because I'm like, oh,
yeah,
like in summertime, I'm like, oh, well, one, she has really nice breasts, and two, I hope she's checking them. I go like I do the whole thing.
yeah,
Right, right. And I mean, and I would be not being completely honest with everybody that's going to be listening to us, if I didn't say I want some boobs back.
yeah,
I mean,
yeah.
I'm fine with where I am in my journey now. I'm super comfortable. Sometimes today I'm just au natural. Some days I wear some bras with extra padding in them, just depending on my mood. But yeah, I'm on this post-surgical journey of weight loss so that I can be at a healthy point to be able to have the reconstruction. But I think I appreciate it more than having that immediate reconstruction, because I am getting to go through this stage of
Yeah,
being flat or almost flat. There are little
yeah,
ones there from goldilocks.
yeah,
You
yeah,
know what I mean?
yeah,
Of getting to
yeah,
go through this other version of me and learning about me,
yeah,
Yeah, I think
you
when
know?
you go through something like this, it definitely gives you perspective
on
Mhm.
life, on your
Mhm.
body, how you view yourself, how you view the skin and the flesh, like your son mentioned. And
Mhm.
I feel like when we talk about body image, what wouldn't we give for more time on earth with
Right.
our family? Like, take my foot, take
Yeah.
my ear. Like, I don't take
Yeah.
my other breath. You know, it's like when
Yeah.
you just keep, like, that's all we want is to feel good and have more time with the people we love. What wouldn't we be willing to give for that? And that just helps me, like, okay, I don't have a
Exactly.
breast. All right. Yes, I'm not symmetrical. Okay. But it's worth it. It's worth, like, I hate that cancer happens to
Yeah.
anyone, but it helps me work through some of those things mentally. Like, I'm still here. Like, I'm still here and I feel good. And
Exactly.
yeah.
And it is, I've saved so much money on bras.
Yeah.
And there's no under boob sweat when it's hot outside. And it's just, I've just tried to really focus on this point in my life and how my body is
Yeah.
and what are the things I can celebrate about it. I'd probably be remiss too if I didn't share my story. Dr. Halaharvi knows this. So I had to go back in for a second surgery because of a little bit of a hematoma, I guess, that developed on the right side. But so they're different shapes. And basically, I refer to them as lefty and the empanada because this one tucks in a little bit, and then kind of like the fork marks on the edge of an empanada is what I kind of liken it to. But so it's I've grown to just know my body and love my body, and this is the stage I'll go through, and then later they'll be somebody else. They'll be Wonder Twins or something. I don't know.
In our breast world, in our medical world, we say they are sisters but not twins. That's like the term we
Yeah,
use, because you're not born with symmetric breasts. They're sisters
yeah,
but not twins. That usually, I mean, even for women, they focus so much on symmetry, and we say you're not born with symmetric breast, and you never,
yeah,
they're never meant to be symmetric, like 100% symmetric anyway.
Mhm.
So there you go, you have them, you
mhm,
have them asymmetric. But and again, I think what you're doing is try to make the best out of the situation, finding that humor in little things. And I have to say, you are wise beyond your ears, because it took me a while to grow up after my own journey, because of my own complications. I was in a place of, I mean, I'll be honest, I was angry for a while of the complications I went through, because it was very early in my career, and I wanted to do so much with my life. I wanted to, I waited, I held my breath for like so many years to get to this point. And so when I did not and had the complications, I was angry. But what I love about you is how you are so positive, and how you're not wasting time in that space of being anger, or having any of those emotions that, if you're stuck in that time too much, you're just wasting this precious time on earth, right? So I just
yeah.
love that you're celebrating this time, and whatever that is, you're finding the best and the positive in it. So
Dr. Harvey, what are some things that when you have patients like Kelli that are going through this big transformation, as many of us do, what are some things that you tell them about body image and how to help us through that, that maybe our audience could benefit from as well?
yeah, and I always tell them, regardless of if you're getting reconstruction or no reconstruction, your body will never be the same as what you had, like what you're born with, what God gave you. No one can recreate that, right? So I think that's important, and it affects your sensation,
Mhm,
sexuality. And I tell them, if breasts play a big role in your sexual life, it's going to be changing. And so I'm honest about that. And I think, honestly, until you go through it yourself, it's really hard to know what kind of things really affect patients. Sometimes I will look at incisions and I'm like, oh my gosh, those don't look as great, but the patients are totally happy with it.
yeah,
But in my own perfectionist mind, I want everything to be 100% absolute perfect, right?
yeah,
So I have to be careful in what I say, because in patient's mind, they look great. She is happy with the outcome. So I have to be mindful of that. And I try to help prepare people, but nothing really prepares you until you go through that journey. And we all grow up with a different background and different information on what breasts mean to you. For some
mhm,
people, just take them off, I don't care. And some people are very attached to them. And so it's very important for me to figure out where that person is in their own journey, and what their
mhm,
relationship is to their own breasts.
right.
So it's important to talk to them about sensation, and how it can affect the sexual function, and how you would look different. Um, and you can always go on to have reconstruction after a mastectomy, whether you had a flat closure, whether you had a Goldilocks mastectomy, or whatever type of mastectomy you had, you always have option of having reconstruction down the road. And I think that's really important for people to know.
Yeah, definitely. And I would share that I think obviously I've mentioned my faith. I think my faith has helped me through this journey in trusting, regardless of what faith you practice,
Right.
or whatever higher power or being that you believe in, is just having that trust and that faith. I've tried my whole life to take every negative thing and say, okay, well, that's pretty crappy, but now what was I meant to do with that? And so taking it and learning and sharing, and I started posting after my diagnosis because I'm like, okay, guys, don't wait to lose weight and lower your drinking and stop smoking and eat healthier. Don't wait till you don't do what I did. Now I have breast cancer. Now I have to rethink some of my habits that I've been slow to change. So I'm like, maybe that's my purpose. Maybe that's why this happened to me, so that I can share and hopefully teach or inspire or whatever comes of it, even just a few people, whether it's to make a change now while they're younger, before they get faced with the diagnosis, or if you have a diagnosis, keeping in perspective and trying to not we all have negative thoughts. That's just the nature of the brain, but your thoughts aren't reality. Reality is you have cancer. That's the only reality. The rest is your story to write. What you think about it, what actions you take, all of that leads to then that result. If I'm in a negative space, that's okay. That's normal. It's scary. It's
Right.
natural.
Right.
Mhm.
But I don't have to stay there.
Tell me about your body image pre-cancer versus your body image now. We touched on it just a little bit. Maybe just go into that a little bit more.
So I've been up and down with my body image. I'd say 98% of the time think I'm fabulous, even as a large woman. I'm curvy, I have proportion, even though I was bigger and heavier. But then sometimes I'd look in the mirror and I'd be like, oh, yeah, maybe that's not as cute as I think it is. But I've tried to be a pretty positive with my body image. But, afterwards, it was this, oh my goodness, what am I going to do? Now I don't have that thing to like help me with the proportion. And I thought, well, it doesn't matter because A, this is me and I love me. B, I'm gonna get this reconstruction, so I have to lose weight. So it's all gonna come back into proportion anyway. And I think in this day and age, what's helped me too is that we now are blessed with an era where people are calling out the Photoshop. There's commercials with every size woman now. And that's not what it was when I was younger. Even when I was younger and very fit and had an amazing body, I was probably harder on myself than in my bigger years and now in my post mastectomy years. And I think that shift in culture, I'd be lying if I didn't say that helped. I don't know. This would be a lot harder to do with the culture of 30 years ago.
We have also come long ways with reconstruction process
Oh,
too.
yeah.
In the 1970s, women had what's called a radical mastectomy, and it's this big, large procedure where surgeons took not just the breast tissue but the muscle and the lymph nodes, and it just left women with the skin and the ribs. Basically, the skin was laying on the ribs; there was no muscle, and it led to lymphedema, enlargement in the arms and swelling and pain, and and we went from that to now a simple mastectomy, nipple sparing mastectomy, Goldilocks mastectomy, and women can have reconstruction. Women can have flat closure. And so I tell women, you have options, talk to your doctor and what's best for you.
Mhm.
If you opt for flat closure, go see someone who does the fitting of the prosthesis. If you are
Mhm.
opting for reconstruction, go talk to a plastic surgeon. There's two types of reconstruction: implant-based or autologous, which means using your own body tissue. Or you can go flat and get tattooing. You can do whatever you want.
There's so many
There are
things.
so many
Yeah.
choices, and not one thing is the right thing. Whatever the right thing for you is what you need to go after, not what Monica is doing or what I'm doing or what somebody else is doing. You have to do what is the right thing for you, what brings you the most joy.
I wanted to ask a little bit more about the Goldilocks that Kelli had. Is this a new procedure?
So it's a procedure that I've been performing with my partner, Dr. Mark Wright, who's my partner. We do all of her double bilateral mastectomies together.
Okay.
And I think the benefit of that is it does cut down time under anesthesia for the patient. And I did bring this back after I went to a conference. It just so happened that Kelly came on just as I was running to conference, and I had a talk about it with her. And I said, I'm actually going to this conference to learn about this procedure. So she was kind enough for me to operate on her and do the procedure.
So was she your first one?
She was my first patient.
Nice.
And I've had six patients since you. So,
and guess what? If we don't like it, we can do something different, do it flat if I was really unhappy or something. And I thought, why not try? Why not try? And if me having the courage to do this even gets one or two other people to have the courage to do it, if they're afraid to be the first, I'll do it.
I will say though, that's probably the best thing, your attitude, number one, which you talked about. We always have control over our attitude. And if you look at in the history, all these people that, have survived and thrived and have done really great with their lives. Nelson Mandela, who was in prison for all those years. I talk about Viktor Frankl, Man's Search for Meaning, who was, incarcerated at Holocaust, and he maintained this great attitude. And someone who goes through cancer diagnosis, one thing we do have control is our attitude. You are not attached to the outcome, right? So you said, okay, Dr. Halaharvi, whatever you think is the right thing for me, I'll go with it. So I said to you, this is the first time I'm doing this procedure on someone. And you said that it's fine. And I said, we may have to go back to multiple surgeries. You said that was fine. And I said, if this doesn't work, we can take off the excess skin and make you flat. You said that was fine. I think that speaks volumes on how you're not attached to the outcome, and you have to find that, that surgeon that you trust with, and that person will guide you through it.
I think this has been a great conversation about body image and ways to combat that. And we've had great conversation, but I want to acknowledge that this is hard. This is so hard, especially Dr. Halaharvi and I were talking about younger women who may have been diagnosed in their 20s or 30s or even 40s that may not have a partner yet. And, the intimacy part. And I don't know if either of you have any advice for some of the ones that may be going through something like that. They don't know, like, okay, when do I tell him I had breast cancer, him or her? What's a way to get through some of those conversations?
Yeah, I think it's really important. So I tell my patients, if you're with a partner, usually the partner and the patient come to my office and we talk about it. But and it's hard for the partner to adjust to that too. And I think sometimes we forget it affects the partner way more than it affects the patient. For younger women who are not, who are dating or not dating and thinking about finding a life partner, I usually say someone who wasn't good for you before you had cancer is still not good for you now after cancer. And you should not lower your standards just because you had cancer. I think what's important is for us to look at ourselves in the mirror and be okay with how we look and how we feel. So, making sure you're not dressing in a closet where no one can see you, or, changing really quickly or turning the lights down. And those things are important. And having that open communication with your partner is the biggest, most important thing. Having your partner touch your scars. And, the funny part about scars is I get asked this a lot is, do you have scars? Because somehow people think I have no scars.
You're a doctor, you shouldn't, right?
And right, exactly. And when I was thinking about recording this podcast, I was thinking, how can I go about showing my scars without it, actually showing my chest? So, there was no way, I could not find a way to do it. But I'm like, I really wish I could show people my scars. I not only have thick scars, I have keloids because I'm darker skinned. I have keloids all over my chest and keloids on my, on belly, everywhere. And I think it's really important to be comfortable with that. Scars, they have a story to tell, right? I am who I am, and that scars are such an important part of my story and my history. I don't want to erase that. I don't want to erase any of the bad things that have happened to me in my life, because that has really made me who I am today. And that's important for the patients to remember that. That's part of who you are, your journey. It's important if you have a partner to let them know if you're not in a mood, or if you don't have a desire, to let them know that medications can cause this sometimes, mood swings, hot flashes, night sweats, vaginal dryness, low desire. That's all could be part of a side effect of a medication, but not because I don't find you attractive anymore.
I thought it was a great point too, Dr. Halaharvi, how you mentioned just keeping that communication open, whether
Yes.
it's somebody new or even if you have a partner already. And I remember telling my husband, like, it's okay to touch my scar. Like, I'm flat on the right side. And even my son, like I put my son's hand on my scar. I don't want him to ever be like, if he ever had someone in the future that was a survivor, I want him to know it's okay.
Let's be kind to ourselves. Let's treat us like we treat our kids. Let's show that kindness, compassion to ourselves. And let's, honor this body that we've been given, our eyes, our hands, our legs, our feet, like all the different things it does on everyday basis to keep us alive. And, embrace those scars. And it takes time to adjust to your body image, how it changes with different surgeries, things like that. Give yourself that time. And remind yourself that, again, the media, it's not real, it's fake. It's the photoshopping, it's the makeup, it's the filter. Spend time with people that, make you happy, make you feel loved and valued. And these sort of conversations are so life-changing. And, it just fills me up and makes me so happy and fills me with joy. And those are the types of people that you want to surround yourself with. Volunteering or helping another woman who's going through it puts you in a different perspective. You think of it as, wow, look at how beautiful she is. Maybe tell her the qualities that she has that she does not see in herself. Buying new clothing or lingerie or camisoles that's lacy or sexy, whatever makes you feel feminine. If that's what you want to feel, new haircut or makeup. Body image plays a huge part in self-esteem. So we have to take care of body image. It's very important to do that. So
thanks, ladies.
all right. Thank you. Bye-bye.
Bye.
Bye.
That was a great
That
interview.
was an amazing interview on body image. And there were so many great points that she touched on. And, loving yourself the way you are. It doesn't matter your size, and what on the outside really doesn't matter. What's on the inside really matters. And embracing those positive things. And, you can grieve your losses. You absolutely must grieve your losses. It is still tough to know that you lost a part of your body that you grew up with, you identified with yourself, but don't stay in that space of being upset or angry or,
I appreciate that about her when she said, like, you can feel that way, but just don't stay there.
Don't stay there.
One quick question for our listeners. If they want to learn more about the Goldilocks, is this like a new thing? Like, are there a lot of physicians doing this? Like, I want to know more. So how could I learn more?
Yeah. So in Columbus, Ohio, I believe Dr. Kripe and I do those together. And I don't think it's offered at the other institutions here. So it's a procedure that's performed for those women who are a little bit on the bigger side and they don't qualify for reconstruction because of their
like
BMI.
Implants, reconstruction?
Any type of reconstruction.
Oh, I didn't know that. Okay.
If you're over a BMI of 38, there's a risk of infection and things like that. So plastic surgeons really prefer to bring them back at a later time for reconstruction. And so for those patients, they also have really large breasts, and after we remove the breast tissue, there's excess skin. So we can use that skin to make a breast mount.
So cool. Okay. So it sounds like it's still fairly new if there aren't other physicians in Columbus or other surgeons.
There are people around the country that do it. And Columbus, Ohio, as far as I know, Dr. Kripe and I do it myself.
That's awesome. Well, congrats on
And,
doing that and finding
so
a patient.
Yeah.
No, Kelli to be so open and willing for you to do that.
She was an absolute gem.
She's like the perfect patient you would want.
She is.
For something
she is like
that.
perfect for so many different things. But yes.
Awesome.
Yes.
Well, thank you so much for listening. And until next time.
Take care. Bye-bye.